Welcome to our educational video on oophoritis, an inflammatory condition affecting the ovaries. In this video, we'll explore the causes, symptoms, diagnosis, and treatment options for this often painful and concerning condition. The most common cause of oophoritis is ascending infection. This means bacteria travel upwards from the lower genital tract, often as a result of sexually transmitted infections like chlamydia or gonorrhea. These infections can spread from the vagina and cervix to the uterus, fallopian tubes, and eventually the ovaries. Less frequently, oophoritis can arise from infections spreading from nearby organs or from complications following certain medical procedures. When bacteria infect the ovaries, they trigger an inflammatory response. This inflammation leads to swelling, redness, and pain in the affected ovary or ovaries. Abscesses, which are pockets of pus, can sometimes form within the ovaries. This inflammation can also damage the delicate tissues of the ovaries, potentially affecting their ability to function properly and leading to complications, such as infertility. Oophoritis often occurs as part of a broader condition called pelvic inflammatory disease, or PD. Because of this, specific epidemiological data solely for oophoritis is difficult to isolate. However, we know that PID, and therefore likely oophoritis as well, is most common in sexually active women of reproductive age, particularly those who have multiple sexual partners or who do not consistently use barrier methods of contraception. Factors that increase the risk of STs, such as unprotected sex, also increase the risk of developing oophoritis. The symptoms of oophoritis can vary in severity. Common symptoms include lower abdominal pain, which may be constant or intermittent and may be worse during menstruation or sexual intercourse. Other symptoms include fever, nausea, vomiting, vaginal discharge, and pain during urination. Some women may also experience irregular menstrual bleeding or bleeding between periods. Diagnosing oophoritis involves a thorough medical history and physical examination. A pelvic exam can help identify tenderness or abnormalities in the ovaries. Diagnostic tests may include blood tests to check for signs of infection, vaginal swabs to identify causative organisms like chlamydia or gonorrhea, and imaging studies such as ultrasound or MRI to visualize the ovaries and surrounding tissues. In some cases, laparoscopy, a minimally invasive surgical procedure, may be necessary to confirm the diagnosis and rule out other conditions. While oophoritis doesn't have distinct classifications or types, its severity and the presence of complications like abscesses or scarring can influence treatment strategies. It's important to remember that oophoritis is often part of a larger infection known as pelvic inflammatory disease, and the treatment often targets the entire PID infection. The primary treatment for oophoritis is antibiotics. The specific antibiotics used will depend on the causative organism identified in diagnostic testing. In severe cases, hospitalization may be required for intravenous antibiotics. If an abscess has formed, it may need to be drained surgically or through interventional radiology techniques. Pain management is also an important aspect of treatment, and over-the-counter or prescription pain relievers may be recommended. The best way to prevent oophoritis is to prevent sexually transmitted infections. This includes practicing safe sex by using condoms consistently, limiting the number of sexual partners, and getting tested regularly for STs. Prompt treatment of any diagnosed STI is crucial to prevent it from spreading to the upper reproductive tract. Regular gynecological exams can also help detect and treat any underlying infections early on. The prognosis for oophoritis depends on the severity of the infection and how quickly treatment is initiated. With prompt antibiotic treatment, most women make a full recovery. However, if left untreated, oophoritis can lead to serious complications such as chronic pelvic pain, infertility, ectopic pregnancy, and tubo-ovarian abscesses. Recent research is focusing on improving diagnostic techniques to identify oophoritis earlier and developing more effective antibiotic regimens to minimize the risk of complications. Researchers are also exploring potential links between chronic inflammation from conditions like oophoritis and other health issues, highlighting the importance of timely and appropriate treatment.